Hi, I'm Jodia with UHC, and Ms. Lenore Evans, our infection preventionist, will be giving us a presentation today.
Thank you. CDC has sent out warnings that Zika is now in the United States. Previously, I sent out warnings to staff and providers that Zika was prevalent in the Caribbean and to warn our clients not to travel there if they were pregnant, or at least to make sure they protected themselves from mosquitoes. But now it is present in all the United States except for Alaska. This map shows the territories, all the countries and territories where active Zika virus transmission is occurring at this time. Zika has been found in Louisiana. There's 39 identified cases of Zika in Louisiana at this time. However, none of them have been transmitted by the mosquito. We have had a transmission by sexual contact, but the rest of our transmission came from travel to a Zika-infested area. CDC warns pregnant women not to travel to Puerto Rico if they can avoid it at all. If they can't avoid it, they must protect themselves from mosquito bites. It is epidemic in Puerto Rico. Zika can spread by sex, so if your sexual partner has traveled to Puerto Rico or one of the most severely affected areas, please make sure that you warn your clients and yourself, if you are pregnant, not to have sex without a condom. They must have condom to protect themselves from this disease. Recently, this week, CDC put out a warning that pregnant women should not travel to the Miami-Dade area. And this map shows the area in Miami where it is prevalent. If your partner has been to the area, if your sexual partner has been to an area that is known for Zika, you must use a condom. You should use a condom, and men should use a condom for at least 6 months following their transmission. It can be transmitted for 6 months after they have an illness. How does Zika spread? It's mainly from a bite from the Andes mosquito. Aedes aegypti is a mosquito that feeds only on humans. And one of the bad things about this mosquito, it is an aggressive daytime biter. Here in Louisiana, we're used to the mosquitoes that bite us from just before dusk until dawn. But this mosquito will bite you all day long and at night. But it's more aggressive during the day. It's also passed from pregnant women to their fetus and through sexual contact, as I stated earlier. We believe it could be transmitted through blood transfusions, but there is no confirmed case that that's happened yet. However, the CDC did ask Puerto Rico to stop collecting blood for transfusion during the earlier outbreak. Now they are testing blood. FDA issued warnings that we should all test blood for Zika, and they are testing it now in Florida and in Puerto Rico. We're not yet testing it in Louisiana, but that will be coming soon, I'm sure. Many people that are affected with Zika don't have any symptoms at all, or they're mild symptoms that they don't go to the doctor for. So that is why, they're telling women who are pregnant to make sure that they know their travel history of their sexual partners and that they don't travel to the areas, because there's time you can contract Zika without having any symptoms at all, and you can have very mild symptoms. But Zika can cause severe birth defects. Microcephaly is the most common, and also other brain defects where the brain doesn't develop normally. And it can also cause miscarriages. The common symptoms of Zika: conjunctivitis, where they'll have a redness over the entire white area of the eye. And they'll also have a rash. The rash can appear anywhere on the body. Joint pain, particularly in the knees. And also they can have other muscle pain and a headache. But again, it won't be severe and it won't last could last for up to a week or two, or it could just come and go quickly. Fever usually doesn't get real high, but they'll have fever at night. Zika testing is now available here in Louisiana. In the beginning, when the first notices that you received, I asked you to let me know if you had a patient in your clinics or in the hospital at the ED that had a suspected Zika, and I would send the sample to the Office of Public Health, but now our laboratory can send it off to LabCorp, our reference lab, and it is available for PCR testing. And PCR testing, of course, identifies the organism much sooner than ELISA test would have. The congenital Zika syndrome, the baby will be born with severe microcephaly, and the skull, where the skull is partially collapsed because the brain didn't form as usual. They'll have decreased brain tissue and brain damage. They'll also have damage to the back of the eye. CDC has no estimation on how long these babies will live or their quality of life. And there have been cases where the baby's head appears to be normal at birth, but as some of you know, because you're in a clinic where you see babies, newborn babies' heads grow as their brain grows. But with a baby that has congenital Zika syndrome, their head can be normal looking at birth, but as the baby grows, the head doesn't grow and it sinks in because the brain's not growing normally. Also, these babies will have other symptoms too. They will have clubbed feet, and they can also have muscle and joint problems where they can't, their mobility is restricted at birth and later too. Ways you can protect yourselves at home is to get rid of the mosquitoes at your home. The way you can do this is to dump water inside and outside. Use screen windows and on your windows and doors, and cover trash cans and any rain barrels. Another part about this mosquito that you need to know is the reason why we want you to protect your homes is this mosquito likes to live indoors too. So it will move in to your house. The mosquito has not been found in Lafayette Parish or the surrounding area since 1950. Now, we've known about Zika since 1947, but it's only recently where we've seen all these birth defects that we've pinpointed it to Zika. We're unsure what the weather will do with the Zika. If we have a hurricane, it could actually blow the mosquito into our area. It is in Lake Pontchartrain area down the road in New Orleans. During hurricane season, when there is a hurricane, however, they do aerial spraying over the marshes and other areas to kill mosquitoes that may have blown in. But the mosquitoes that have blown in the past from our hurricanes have been the marsh mosquitoes. They've not been the Andes mosquito. So we haven't seen that yet here. But we are planning to take Office of Public Health in conjunction with the state have control areas in mind. CDC recommends that we use DEET repellent containing DEET to repel against these mosquitoes. You can find concentrations from 4 to 100%. This is not the strength level. If the concentration doesn't make it more effective, a higher concentration, it just makes it last longer. DEET can cause skin rashes, but it's rare unless you put DEET on underclothing. DEET should not be put, you should not spray a DEET-containing repellent under your clothing. You can spray it on your clothing, but you shouldn't spray it like on your back and then put on clothing, because it can cause a rash if you do that. The Office of the FDA and the National Pediatric Society has declared that DEET is safe for children 2 months old and older, as long as you don't use concentration of greater than 30%. So you can use off on children. You should never spray off on a child. You should use lotions. Repellents come in lotion, spray, and also liquids. Do not allow a child that's under 10 years of age to spray themselves. I think that's kind of common sense, but we need to make sure we tell our parents these things. We apply it to them ourselves. We don't apply it to very young children's hands because they put their hands in their mouth all the time. And if you breathe it in or you swallow it, DEET can be toxic. And you don't want it in their eyes, of course. And you wouldn't want to put any kind of insect repellent on a wound or a sore or any broken skin. And of course, store it out of reach of children. To apply to your face, you spray it to your hands and then you rub it on your face. You don't spray it to your face. And remember that higher concentration of DEETs don't protect you better. It just lasts longer. On babies, they recommend that you protect them from mosquito bites with a mosquito net. They make a net that has elastic on it that you can put over a car seat, a carrier, or a stroller to protect the very young, because you can't put DEET on